February is Heart Month, time to take stock of your health. Do you know what shape your heart is in? You could learn a lot with a simple, quick, and inexpensive scan to determine your heart calcium score. What you're seeing is me 2 years ago when I went in for the scan. I have the appropriate risk factors, family history, age, and I wanted to see what was happening inside. The procedure took about 15 minutes, cost about $50, and my doctors were able to give me the good news that my score was a perfect zero. Well, that was not the case for sisters Sue Belinsky and Kay Nelson. They are both here today along with cardiologist Dr. Todd Fergus to talk a little bit about this scan, but more importantly, heart disease, how it has affected your family, and what we can all learn from your story. Good morning to you all.
Good morning.
Good morning.
Sue, let me start with you. What is the situation with your family and heart disease? How bad?
Our father passed away about 40 years ago. He was actually only 40 years old of a heart attack. We have 5 children, and out of the 5 children, 4 of us have coronary heart disease. We just lost our brother last October, age 49, from complications of the coronary heart disease.
So you've known for a couple of years that this is part of your family, and you got checked and you had the calcium score done. What did you learn from that?
I learned that I tested out very high, and I got a procedure, and I got on the program of exercise and diet, and I was shocked, but I'm treating it.
We have a couple pictures that you sent in of your family, and as we look at those, Kay, tell us then your story.
My story is I had a calcium score done. I scored high as well, and I changed my diet and learned to exercise more.
And you're young.
Yes.
You're still in your 40s,
Yes,
right?
I am.
And the picture of your brother, he was the life of the party.
Yes,
Yes,
he
he
was.
was.
Yes.
And so this was so devastating for your family, but it was, I mean, kind of a shock to all of you then to get your own heart checked.
Yes.
And doctor, what is the calcium heart score? What do you learn from it?
So a calcium score is a quick test to check for evidence of plaque in the heart arteries. A common misconception is that it's a test for blockages, which it is not. It's just a test to see if there's plaque in the arteries, and if there's plaque there, we can target that patient for more aggressive interventions such as a heart-healthy diet, regular exercise, and possibly medications as well.
Okay, so back to you two then. So you took the calcium score, learned that you had to have further tests, and take further action to make your hearts healthier. And you mentioned that that included getting stents. You both had surgery next door to each other, is that right? Same time?
Yes, we did.
Same hospital?
Yes.
Tell us about that.
It was very emotional, very, and very surreal. Couldn't believe we were going through it.
Especially once that we realized we had the blockages, and I had another stent put in. K2 had one. It was just very surreal for us, very emotional.
And you've had to do a lot since, and we were with you. We have some video of you going through rehab. What did you learn about taking care of yourself through all of this?
That department, it's the rehab, is a wonderful department. They're very informative. They monitor your heart, so we know when we graduate, this is where we're at and what we're doing, and how many miles we walk, and we learn recipes they give us and spices, and
Yes, they were very informed.
And I know one of the reasons you wanted to come on here is to talk a little bit about the symptoms of a heart attack, because your brother wasn't experiencing the pain down his arm. What was he going through?
He had flu-like symptoms.
Flu-like symptoms.
Yes.
And this is flu season.
Yes, he thought it was his allergies also. And he had flu-like symptoms, the sweating, the nauseous.
And then you, Sue, were starting to feel some of the same things?
I did. After his passing, I felt just kind of the same symptoms, and I was having a checkup anyway in December early, and said, maybe I should try another stress test.
And doctor, that's the case with a lot of people, men or women, they experience heart attack symptoms differently?
That is true. Very few people have the textbook, what we consider classic anginal symptoms. A lot of people will have what we call atypical symptoms such as fatigue, shortness of breath, flu-like symptoms. Anything out of the ordinary, particularly if it's persistent, should be should be taken seriously.
And we do have some graphics we want to get to. Who should get that calcium score? And I know it's just the beginning, the first step to take, but who should be getting that first look at their heart?
Anyone who's concerned about their future risk of cardiovascular events should consider getting a calcium score. Oftentimes that is someone who has a strong family history of coronary disease, but other times it's people that just have mildly elevated cholesterol and they're trying to determine whether it's worth taking medications or not, or just anyone that's concerned about their heart. It's a very simple test. Like you said, it's only about $50, and it gives us a quick look at whether that person has plaque in their arteries or not.
And then you can take further steps. Any final words, Sue?
Please go out and get one. If you can, I strongly urge to have a calcium score done.
And Kay?
Be aware of your symptoms. It's not always the flu.
Well, thank you so much for sharing your story, and hopefully we've helped a few people out there in the Green Bay area take steps towards heart health. Doctor, thank you to you too.
Thank you, Rachel.